Hello friends, welcome back to my YouTube channel. Today's video is the continuum of the series of the vital signs. The video is on the first vital sign, which is body temperature. Hope so you will enjoy the video. Meanwhile, do not forget to like and share the video and subscribe the channel. So, without assessing the temperature, let's go towards the main course. As today's video is on body temperature, we should know what does body temperature means or how we define the body temperature. Basically, body temperature reflects the balance between the heat produced and the heat lost from the body. It is measured in heat units, which are degrees. There are two kinds or types of the body temperature: core temperature and the surface temperature. Core temperature is the temperature of the deep tissues of the body, such as abdominal cavity or the pelvic cavity. Core temperature always remains relatively constant. On the other hand, the surface temperature is the temperature of the skin, the subcutaneous tissue, and the fat. By contrast, it rises and falls in response to the changes in the environment. There are many factors that affect the body's heat production. These factors are directly proportional to the body's heat production. As the rate of these factors increases, the body's heat production also increases. The most important of those factors are as follows. First of all, BMR, which is also known as basal metabolic rate, muscle activity, thyroxine output, epinephrine and norepinephrine, sympathetic nervous system, fever, and the age. The basal metabolic rate or BMR is the rate of energy utilization in the body required to maintain essential activities such as breathing. As the rate of these essential activities increases, the basal metabolic rate also increases, which produces high amount of heat. Muscle activity. Muscle activity including shivering, exercise, or any other kind of activity. These activities increases the metabolic rate of the body. In return of this increased metabolic rate, body produces high amount of energy. On third, there is thyroxine output, which is a hormone. This hormone is released by a gland which is known as thyroid gland. Thyroxine is also known as T4 hormone. It controls the metabolic rate of the body. So the increased thyroxine output increases the rate of cellular metabolism throughout the body. On 4, epinephrine and norepinephrine. Epinephrine and norepinephrine immediately increases the rate of cellular metabolism in many body tissues. It means it is specific for many tissues, or it does not increases the whole body's metabolism. But in any case, it increases the metabolic rate of the body. So, due to the increase in the metabolic rate of the body, the heat production of the body also increases. On 5, fever. Fever increases the cellular metabolic rate and thus increases the body's temperature further. On 6, sympathetic nervous system stimulation, such as with stress. It also immediately increases the metabolic rate of many body tissues. On 7, age. Metabolic rate varies throughout the lifespan of any individual. In general, the younger the client, the higher the metabolic rate. In that case, the body's heat production is also high. If we talk about older people, they are usually at the risk of hypothermia due to the low metabolic rate. Regulation of the body temperature. When the skin becomes chilled over the entire body, these three physiological processes occur. First of all, shivering increases the heat production. On second, sweating is inhibited to decrease the heat loss. Third, vasoconstriction decreases the heat loss. On the other hand, when the temperature rises in the environment, these three physiological processes occur. First of all, shivering inhibits to decrease the heat production. On second, sweating starts to increase the heat loss. On third, vasodilation increases the heat loss. Alterations in body temperature. The normal range for adults is considered to be between 36 Celsius to 37.5 Celsius. There are two primary alterations in body temperature: pyrexia and hypothermia. Pyrexia. A body temperature above the usual range is called pyrexia. Hypothermia, or in lay terms it is also known as fever. A very high fever, such as 41 Celsius, which is equivalent to the 105.8 Fahrenheit, is called hyperpyrexia. The client who has a fever is referred to as febrile, and the one who does not is afebrile. There are four common types of fever: intermittent fever, remittent fever, relapsing fever, and constant fever. During an intermittent fever, the body's temperature alternates at regular intervals between the periods of fever and the periods of normal or subnormal temperatures. An example is with this disease is malaria. During a remittent fever, a wide range of temperature fluctuation occur, more than 2 Celsius, over a 24-hour period, all of which above the normal temperature. Remittent fever is related to the cold and influenza. In relapsing fever, short febrile periods of a few days are interspersed with a period of 1 or 2 days of normal temperature. During a constant fever, the body temperature fluctuates minimally, but always remains above the normal temperature. Hypothermia. Hypothermia is the core body temperature below the lower limit of the normal body temperature. Assessing the body temperature. The most common sites for measuring the body temperature are oral, rectal, axillary, and tympanic membrane, and there is also temporal artery. There are many types of thermometers: mercury thermometer, electronic thermometer, chemical disposable thermometer, temporal artery thermometer, infrared thermometer, temperature sensitive tape, etc. That's all for today, friends. Peace out.